tobacco control policy in Malaysia. So it's more about the law, regulations, strategies, and also the intervention that has been done to reduce smoking prevalence, to reduce initiation of smoking, and also to reduce the exposure of second-hand smoke to vulnerable group and also to us non-smokers. Okay? Okay. By today, I hope you'll be able to analyze the current trends, challenges of the global tobacco epidemic, and explain the role of international collaboration in addressing them, and then able to describe and apply key components of WHO FCTC framework, and also you'll be able to evaluate the effectiveness of Malaysia's national strategic plan for tobacco control. So these are the content that I'll be sharing after this. And so, do you think how much our life is worth? Do you have any idea? 1 billion, 3 billion, 1 trillion? Priceless. Okay, let's see this video. I hope it's working. So if not, we just share later. So let's watch this video. How much is our is a life worth? So how many of you agree with the price? Only 6,000 USD. That's no, you don't agree, right? So it's worthless. Okay, that's what tobacco industry think. Only 6,000 USDs, and they have to find replacement every year, every day. So the target is our next generation, our youth, right? So we are here to protect our next generation. Okay. Okay, what is epidemiology? Belajar epic sikit hari ni. Kan? Because we need to understand what is epidemiology, so this is very important. We need to understand the current trends of tobacco prevalence, the causes and effect of health and disease conditions in defined population. So in this case, the defined population is the smokers or tobacco users, right? So this is the cornerstone of public health. So we need to understand who is affected, when they are affected, and when they are affected, so that we can design the public health interventions that suit to the target population. And it also important to us to understand what are the risk factors for the smokers, why they smoke. Okay, so this also help us to target for preventive measures. So globally, we've seen a decline in worldwide tobacco use from 22.7% in 2010 to 17.2% in 2025 last year. So yet, more than 1 billion still smoke. Right? We have more than still use tobacco product, and this contributed to 8 million deaths, including 1.2 million second-hand smoke. Okay. So while these traditional smoking rates are declining, so we've seen the pattern reduction in conventional cigarette, but the risk of alternative tobacco product, e-cigarettes, heated tobacco product, and smokeless tobacco, this is the new challenges for us, especially among youth, right? And in 2025, it is projected that 82 million people globally will use e-cigarette, and we cannot avoid the economic impact of smoking, right? So especially in the low and middle income countries, so 1.43 trillion annually. And regionally, smoking in Asia, okay, about 70% of men smoke, and 8% of women smoke tobacco in Asia. And the average age at which they started smoking was 22.8 years, which is among men a bit lower, 22.1 years, okay, and among women 28.2 years. This is Asian data. And also, if the tobacco epidemic across Asian population persists or grows steadily, so if we have done anything to prevent this, most Asian countries will face the double burden of lung cancer attributable to both tobacco smoking and other background of risk factors. Okay? And this is the data from Malaysia. Okay? What the data tell us? So there are two important messages here. Okay? We've seen the decline, but it's very slow. But there's a progress. So there's two things here. Okay? One, the effort that we have done, okay, the public health effort, it contributes to the reduction of smoking prevalence in our country. But another message that I want to convey is the problem is still persists and remain challenges. So this and also with the e-cigarette and vape. And this is the legal framework from the top X, regulation, code of practice, and guidelines. So I will talk this detail later. So the Act is a main law enacted by Parliament. So this is our new Act, control of smoking and tobacco product for public health. Okay, and the regulation details for enforcing the Act are gazetted by Minister. And we have a code of practice. This tells us how organization comply by the law. Okay, and we have guidelines to do the intervention and also the implementation at the population. So how big is the problem in our country? So where are we now? So smoking is still #1 public health problem. So currently we have about 20% of smokers in Malaysia and more than 20,000 deaths annually. And we have most of the smokers, they actually want to quit. Almost 60% they want to quit, and we need to help them. So that's why you are here to get trained and to assist them. Yeah, to assist them to stop smoking. So all of the staff are obliged to ask, advise, and assist smokers to quit smoking. So we hope that we can achieve our next strategy, to become a smoke-free Malaysia by 2040, which is less than 5% prevalence of smoker in Malaysia. Okay, WHO Framework Convention on Tobacco Control. So this is the first global health treaty. Okay, with Malaysia also signed on this, one of the 183 members. We signed on 23rd September 2003 and ratified the WHOFCC on 16 September 2005. So the main secretariat is WHOFCC under Ministry of Health. Okay. And Article 14, as mentioned by Prof. Amir, is under offer to help. Okay. Each party shall take effective measures to promote cessation of tobacco use and educate treatment for tobacco dependence. Okay, what are the MPOWER strategies? So these are 6 strategies under WHO FCTC. MPOWER: M, monitor tobacco use and prevention policies. P, protect people from tobacco smoke. O, offer help to quit tobacco use. So you are here under this offer help. One about the dangers of tobacco. E, enforce bans on tobacco advertising, promotion, and sponsorship. And lastly, we have raise taxes on tobacco. So for M, monitor, our target is to reduce smoking prevalence to 15% by 2025. So this is the data that we monitor until 2025. So Malaysia has shows positive improvement, but the reduction is a bit slow. So I think we have to think how to achieve this, and I hope that we are able to help to achieve this target. And for P, protect people. So currently we have 23 smoke-free places, tempat larangan merokok. So this one under Article 8. Okay, and under the new acts, smoking and vaping have now been prohibited in numerous public spaces in Malaysia. Okay, and the ban is part of the Health Ministry's control of smoking product for public health Act 2024, which is come into effect on 1st October. So under O, this is the first and quit smoking clinic. Okay, I think this one we have about 700 plus clinic last time. So, but now you can refer to jomquick.my. So there's a lot of quit smoking clinic under our quit program. Okay, W, what about the dangers? Okay, it's about the pictorial health warning and also plain packaging. So for the pictorial health warning, we want to convey the message and also to denormalize smoking. Okay, and also we want to show the impact of also the consequences of smoking on health. Okay, and also for the plain packaging, we are targeting on plain packaging is not yet been implemented in our country, so we are moving towards that. E enforce bans on tobacco advertisement, promotion and sponsorship. Okay, so you see here, okay, prohibited on the billboards, right? And we already achieve here ban point of sale. So previously it was here, you can show this, but now we are here under the new acts. Okay. Okay, raise taxes. Malaysia applies a specific tax rate of 40 cents per stick on cigarette. And the last tax increase was 2014 and increased 12% of excise duty from the previous tax rates. And this is the high tax and price in Malaysia compared to other Asian countries. And actually, it should be adjusted annually. But you see here, from 2014, but now it's already 2026, right? So, yeah. And the absence of long-term tobacco tax policy, the increase has been small and ad hoc, and also cigarette continues to be affordable. Okay. And it is actually evidence that increasing tax price can reduce the smoking prevalence. Okay, and this is data from the WHO, and also the studies have shown that every 10% increase in the price of cigarette reduces consumption about 4% among adults and about 7% among youth. Okay, so this is evident. Okay, tobacco control in Malaysia. Okay, from the WHO FCTC, so we have done a lot of improvement. Okay, we have Akta Makanan 1983, but now we have Control of Smoking Product for Public Health Act 2024, and we also have a National Strategic Plan on Tobacco Control 2015 to 2020, and then the second National Strategic Plan, this is the current NSP 2021 to 2030. Okay, Malaysia became a party of the WHO FCTC on September 2005, and then since then we have applied MPOWER measures. Okay, and all the activities were regulated under the Food Act of 1983, and we have Control of Smoking Product for Public Health Act 2024, which is the first comprehensive standalone tobacco Control Act. Okay, according to NCD, non-communicable disease global target, so we aim for 15% prevalence of smoking by 2025, and we are moving towards the endgame target for Malaysia, which is less than 5% prevalence by 2040. And this is aligned with the SDG 3A, strengthen the implementation of the WHO FCC on tobacco control in all countries as appropriate. Okay, what is actually tobacco endgame? How we define tobacco endgame? So these are definitions that set by Thompson et al. 2012. So they suggested some elements should be considered in defining the tobacco endgame. First, low smoking prevalence, for example, less than 5%. So we have said that the prevalence. Second, end of commercial sale of tobacco products. Third, denormalization of smoking culture. And fourth, zero exposure of tobacco use to children. Okay, hard smoking initiation by the young generation. There are three main strategies: empowering the community and strengthening multi-sectorial participation, strengthening the law and enforcement on tobacco control of tobacco and smoking product, and collaborating with professional bodies, NGOs and private agencies in implementing and quit services. So that's why our NQUIT program, this consists of NGOs from NCSM and also government sectors. We have universities and also industries. Okay, so we work together and collaborate to achieve this smoke-free generation. And under NSP, one of the mission is all Malaysians born in 2009 onwards will not start smoking. So how old are they now? I think about 17 or 18, right? So this is one of the mission that we set under NSP. So different countries, they have their own endgame target. For example, New Zealand, they set for 2030, okay, to achieve endgame. Okay, way forward. So as I mentioned, the journey requires collaboration. Okay, so by combining international best practices, so we also work with international universities, also international agencies. Okay, and also Malaysia can create a stronger policy framework that not only reduce prevalence but also mitigate economics and health burdens. So the new acts, Control of Smoking Product for Public Health Act 2024 is a promising start, okay? But its success hinges on robust enforcement, ongoing innovation, and the active involvement of all stakeholders. So you are also the part of the tobacco control effort. So we need your effort and also your contribution as well. And tobacco control is just not about reducing smoking rates, it's about improving quality of life and safeguarding the future health of our nation. So we need to work together to ensure Malaysia leads by example in creating a healthier, smoke-free world. So these are few take-home message. Smoking is the #1 public health problem globally. Ultimately, the single item that can eliminate future tobacco-related deaths and illness is significant continuous reduction. So the effort also need to be continuously done and improved. How to reduce the prevalence? So by preventing tobacco uptake, especially by youth, and also tobacco cessation by current user. And this tobacco control activities is strengthened by FCTC, WHO FCTC. And Malaysia has a good history in implementing FCTC. We have NSP and also we have our endgame target. Okay, last but not least, tobacco control is challenging but rewarding. So we have seen a lot of improvement, and also I'm not sure about your age, but during my age I can see on the billboard and also during the football match. I can see the promotion of Marlboro, right? Marlboro, what else? Peter Stevenson, but now I cannot see anymore. Okay, even on the TV. Okay. And you can develop skill and competence in various aspects of tobacco control. Whether you can, whether you want to be a researcher, you want to be advocate, or you want to do practice in smoking cessation. So there's many areas that you can contribute to tobacco control in Malaysia. And your contribution, and also you can establish good networking with the experts in tobacco control. So today the conference, the 3 days conference, we have so many experts, right? So you can do networking, and also you can contribute in whatever your preferences, okay? Your interests, and contribution matters to fight for the end game, and you can make a difference in the lives of others. Okay, with that I thank you.